to pharmacists, like you want to mention like maybe the methadone program or medications or legal injection sites or you know, something to do with their field, because then they'll have more interest. Or if you're talking to like emergency room doctors, you could talk about like overdose management or how you're treated after you get have an overdose and end up in the hospital, and you know, they tell you to go home or whatever, or throw you in the psych ward or detox center or whatever. So you can tailor your speech to like the people you're talking to, and that makes it a little more powerful. So if I'm talking to like psychiatrists about mental health issues, I'll mention the ECT treatment and like medication that wasn't affected, even though I had medication resistant depression and post traumatic stress and a bunch of stuff. So I'll kind of speak their language and be like, yeah, I have complex PTSD and like medication resistant depression and this happened and that happened. So that way they're interested. But if I was talking to like family members or caregivers for people with like mental health and addiction issues, I might not go into all the diagnosis and medication type stuff. Yeah, so you want to be conversational. It's okay to have notes to refer to, but you don't want to be reading like every single word. So have your points like in an outline and then make eye contact. Some people find it easy to like write on cue cards in big letters, like with a big marker, and just write keywords. And then look at the keyword and be like, oh yeah, I'm talking about this now, and blah, 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 blah. Okay, on to the middle part, and this happens, and okay, it's my conclusion. Well, if you have any questions, and thanks for coming, and that kind of thing.
And I was just going to add, it's hard at first. It really is, because even though you know your story, you're trying to remember the order, and you know that people are staring at you while you're doing this. But I think over time, and if you have, like, just say we're going to work on stories over the next 2 weeks, and it's something that you'll refine, and even past this workshop, you'll look at it and go, oh, well, maybe I want to add this and take this off here. You'll get more familiar with it as you work on it, and you'll have less need to use the cue cards and that. So,
Right, you know, yeah, you see the president or whatever on TV with cue cards too, or they're reading from teleprompters, like TV screens that you can't see. You want to speak with passion and energy and be really enthusiastic about what you're talking about. If you're boring, people will shut down. They'll just tune out and think about like their to-do list and what they're going to make for dinner when they get home or whatever. And then be patient with yourself. It's easy to get frustrated if you make a mistake. I remember public speaking once and completely like going off topic and then having to get back on track again. And it takes time to hone your skills and develop you know, the confidence and it takes practice. Like, you're not gonna play the piano awesome in like your first attempt, right? But keep practicing and you'll reach your goals. So what we're gonna do now is I'm gonna do a little brainstorming exercise. And you get a book. Everybody gets a book to brainstorm, and there's some pens. And I don't need a book, so you can have this one.
Is it alright if I take one?
Yeah, go for it.
do you want?
So,
One for me?
Oh,
I want to brainstorm.
oh, do you need more?
That's
I have
fine.
more. Morgan was gonna take some home
Yeah, you
with
can
her.
take this one if you want,
Okay.
and then
Oh, I got more.
It was just
Here.
for other folks that maybe can't get the book.
Here's some more.
Okay, I'll take one.
Okay, so that's your notebook. Can you all see this if I'm here, or should I move it over?
Maybe.
I can move it over.
And use a darker pen because I can't
Yeah,
see the green
yeah.
and it just
It's-
disappears.
Is it blue better?
Yeah.
Yeah.
Oh.
Okay.
Where did the blue pen go? There we go. Yeah, so this comes from a guy named Tony Buzan, who invented this term mind mapping, and it's a way writers use to create ideas. So what you do is you draw a circle in the middle of your page, and then you come up with what you want to talk about. So what would be a good scene to present to
Pharmacists, doctors.
pharmacists,
emergency room.
doctors, emergency workers at the hospital about your story? Do you want to talk about addiction issues or substance use or recovery or mental health or
I'd want to bring it